Hi, folks. This is John Adamson, the Rehab Documentation Guru, and today we're going to look at what makes a proper analysis. At least we're going to look at the beginning of an analysis and how to start formulating it. There's some other details we might want to consider, but what I'm going to do is I'm going to talk about the basis of analysis from things that we measure, but I'm also going to talk about the basis of analysis from things that happen with the patient, like let's say an acute illness. The first thing I want to do is go over a basic definition of analysis. It's a detailed examination of the elements or structure of something, typically as a basis for discussion or interpretation. So note those highlighted words there. And then I wanted to highlight interpretation because we can use these words pretty much interchangeably, analysis and interpretation. Interpretation, the act of explaining the meaning of something. So that's what we're doing with an analysis. And if you've been to my course, you know I correlate or I compare an analysis to telling a parable, a story with a deeper meaning. And so, therapy analysis should be doing interpreting, should be making sense of things. And what we must make sense of is the correlation between functional deficits, things that everybody can see, things that cause the patient to have problems in everyday life and activity and whatnot, and the underlying impairments. And in another video I talk about this, but the underlying impairments are the things that we can measure that take some skill and knowledge to measure safely and effectively, things that we can measure that are causing the functional deficit. So we're going to go into a little bit more detail about these things right now. So we're going to look at an example of a sittest and transfer. That would be a function that a patient's engaging in. It would be under a more basic category of mobility. And being a functional deficit, we need to get to the root cause or underlying impairments that are causing the problem with this area. So it could be a number of things, and I just listed out, various and sundry things that could be underlying impairments that we can quantify, we can provide a measurement for to determine, is this thing impacting the function, in this case of sittest and transfers. So we're going to take this information, the function and the underlying impairments that we measured, and then we're going to formulate an analysis. Because what we're looking for, what we're trying to prove is that there's an impact of these things that we measured. And most of these things that we measure are things that we can address. And as therapists, we learn to treat these things. So we're trying to help the reviewer of our claim see the correlation between the functional deficit and the underlying impairment, because that's where our skill comes in. So here's an example of an analysis statement. And it says the patient's sittest and transfers have improved. And I noted here, see change in functions section. We should have some part of our note that shows objective functional gains, objective underlying impairment gains. It might be in the goals section. But anyway, let's continue. Patients sittest and transfers have improved due to increased right knee flexion and upper extremity strength. Now, if we're going to say something like that in our analysis, we better have the measures to validate it. A lot of therapists will say stuff like this with nothing to prove it. We got to prove this is true. Did they actually gain range? Do we have a measurement for it? Do they actually have improved strength? So this is the basis of analysis, comparing a function to underlying impairments or maybe a single underlying impairment. Now let's go on here. The patient continues to have deficits with transfers and is not safe or effective in this area of function due to balance measurement of blank. Now, one of the things we want to do in our analysis statement is kind of tell them, if we're going to keep seeing this patient, is the patient, number one, safe to perform the activity? And number two, is it going to be effective for them to continue on without us? If we're going to keep them on therapy, one of the things we've got to show is that there's a barrier to preventing them from being discharged at this time. Therefore, we got to see them a bit longer, and that's partly what your analysis statement is going to provide. Here's an example of an acute illness related, and how we're going to relate this to the analysis. This is just a little bit of history of what's going on. You have a patient with C. diff. They've got a lot of diarrhea going on, Unfortunately, the diarrhea has caused them to become somewhat dehydrated. Nursing's trying to work on the dehydration, but the patient, as a result, is hypovolemic, low blood volume or low fluid volumes in their body. So they become posturally hypotensive, and there's a blood pressure drop. Now, that blood pressure drop is what we would call an underlying impairment. It's something that we can measure. It's also something that not everybody else knows how to measure, and not everybody has the skill to interpret. So, like if, let's say this patient was an inpatient, a CNA taking the vital signs does not have the interpretive skills to determine that the patient is hypotensive arising from changes in position. But you, as a therapist, are. So by careful monitoring and adjusting the patient's transfer techniques and activities, you are going to demonstrate skill. And here's just an example of how this analysis statement might start to look. Patient's blood pressure is blank while sitting supine, whatever those measurements might be, allowing patient to have no signs or symptoms of dizziness or weakness. But upon attempting to stand with normal speed, so just like we can gauge as a therapist what probably is normal sit to stand. We can use some standardized tests for that. But anyway, the patient tries to stand with normal speed, blood pressure drops to blank, causing the patient to lose balance and require blank assist to safely and effectively perform tasks. So we're trying to show them that this new disease, C. diff, which a therapist does not treat, causes other things, though, underlying impairments, that we can treat. And in this case, we're trying to show that there's a reason we need to see the patient, even though perhaps in this case the C. diff is causing a delay in achievement of goals. That way we can show that we're reasonable and we're necessary during this time when the patient's ill. Anyway, this has been a brief tutorial on formulating an analysis. I appreciate you being on this, watching this video, and if you have any questions or comments, please leave them. Also, please hit that like and subscribe. Tell your friends about this channel, and I appreciate you very much. Have a great day.